All right, good afternoon. This is Dr. Brian Crable from the University of Scranton. I'm following up. This is video two or volume two of my Epidemiology during COVID 19 video series. This video is going to focus on chains of infection. I do want to let folks who are watching this at home who may have young children running around that there are anatomical depictions as part of this video. So just be advised of that as we're going through that. Okay, I wanted to take just a few seconds here and highlight sort of the organization of this video series. So many of you may have seen video number one, which is an introduction to the series. It talks about the motivations for putting it together, as well as some of my goals for my students, as well as disseminating this more broadly within the university community. Video two, so this video is going to focus on chains of infection. From here, we'll move on to video three, which talks about patterns of infection. That's where we start to talk a little more broadly and a little bit more in depth about epidemiology and some of the epidemiological terms that you may be hearing in the news. From there, we're going to move into video four, which focuses on the social and cultural aspects of epidemiology. So, for example, as you might guess, social values and cultural values have a pretty tight link to epidemiology. So we'll talk a little bit about the Ebola outbreak in West Africa and how cultural burial practices contributed to the spread of disease there. We'll talk about in the United States how people's attitudes towards sex and sexuality influence compliance with HPV vaccinations here in the United States. Then in video five, because the whole purpose of this video series and making it publicly available is to provide sort of some foundational background knowledge to help people understand what's going on in the news with respect to COVID-19. The final video, video five, will focus much more specifically on COVID-19. So before we dive too far in, I think there are a few terms that we want to define and be cognizant of their meanings and make sure that we are using them appropriately. The first one, disease, I typically define that, and I think most textbooks would define it as some sort of deviation from the normal body state. So, for example, cancer is considered a disease. HIV and AIDS is considered a disease. Typically, these are identified by signs and symptoms. So signs would be objective evidence of a disease, for example, vomiting. Symptoms are going to be subjective evidence of a disease, things like pain, right? The reason I want to make this distinction clear is because the next two terms, so infection and pathogen, are not, they are related to disease, but not every infection becomes a disease. And in fact, infections may manifest later in life as a disease while the person may have been infected for days, weeks, months, or even years, and transmitting those infections to other people without ever showing any signs or symptoms of disease. So that brings us to our next definition, an infection. In class, we've talked a little bit about the human microbiome. I want to point out that an infection is an established population of microorganisms or viruses which is not part of the normal flora. So for example, we talked about the normal gut microbiome. When we have something like Vibrio cholera come into our gut and establish itself, that would be an infection. So Vibrio cholera is not a normal part of the gut microbiome. And while it is in the gut, it would be causing an infection. Similarly, human papillomavirus is not a normal part of the vaginal or the throat or the anal community. And so when it is present in any one of those environments, it would be considered an infection. And then the final term that I want to define, at least on this slide, is with respect to what a pathogen is. So a pathogen is going to be any microorganism or virus that is capable of causing an infection. And again, pathogens, a pathogen causes an infection, and an infection is just any established growing population of microorganisms or viruses which isn't typically part of the normal flora for that particular environment. Okay, so the reason I went through all of that is there are a few key points that I want you to remember. I want you to remember that infections do not always cause disease. So, for example, you may be infected with some sort of pathogen that your body is able to fight off, and you'll never actually exhibit symptoms of the cold. Uh, People may be infected with human papillomavirus for months or years, and in fact, that is a particularly good example of a infection which doesn't manifest as a disease until later in life. So, for example, sexually active individuals may contract the human papillomavirus infection in their teenage years or their early 20s and may not show signs or symptoms of cervical or throat or anal cancers until well into adult life. There's also the famous case of typhoid Mary. So asymptomatic carriers are still infected. So these are individuals who have the infection. It's actively growing, actively established, and they can transmit it to infection. They can transmit that infection to others. So typhoid Mary was working in New York's food industry, and she transmitted typhoid to a number of people. She was asymptomatic. She refused to wash her hands and use good hygiene practices, and she did transmit typhoid to a number of people throughout New York. So again, these are just some key points that I want you to remember. Basically, that infections don't always cause disease. Asymptomatic carriers are still infected, and they can transmit the infection to others despite not showing any signs or symptoms of that infection. And then there are also this whole class of infections, again, human papillomavirus being a good example, and a very clear example of an infection that doesn't actually manifest as a disease until later in life. So one of the fundamental questions that we want to be able to answer when we're talking about infections and disease is, how do those infections first establish? And typically they come into the body through a portal of entry, and they'll establish it at a mucous membrane. So you may be aware of mucous membranes associated with your eyes or your ears, nose, mouth, urethra, anus, right? So typically these portals of entry are places where the pathogen first enters the body and where they start to set up a localized infection. We can also have more systemic bloodborne infections that are transmitted that enter into the human body through things like an insect bite, intravenous drug use, lacerations, or burns. And typically these portals of entry are fairly characteristic of the individual infections. But again, as we'll see later when we talk about the particular chains of infection, that while something may be predominantly associated with sexual activity, so for example, HIV or AIDS is primarily associated with sexual activity, there have also been widespread outbreaks where people have contracted HIV or AIDS through intravenous drug use. And so I think it's important to recognize that while there are characteristic pathways associated with the individual infections, there can be a number of different ways in which they enter the human body and they establish an infection. But typically, when we think of infections, we think of them being established at mucous membranes associated with the eyes, ear, nose, mouth, urethra, or the anus. And then we can also have blood infections that come from things like insect bites, IV drug use, lacerations, or burns. Similarly to the portals of entry, we have the portals of exit. These are how the pathogens are going to leave the body, right? So they're going to leave the body and go infect another individual. So typically, pathogens leave the body through human fluids, through bodily fluids, so things like blood, semen or vaginal secretions, urine, and stool. Pathogens can leave in respiratory droplets. So again, coughing or sneezing can cause pathogens to leave in respiratory droplets. Pathogens can be shed and aerosolized. So, for example, measles, as you're breathing out, the measles virus will attach to dust particles in the air, and they'll actually hang around for several hours after you leave an area, which makes them particularly infectious. And then, of course, pathogens can be carried by other organisms, which are called vectors, and we'll take a look at that when we talk about patterns of disease transmission. But there's a really important classification of diseases called the vector-borne diseases, and I'm sure many of you are familiar with things like Zika virus, West Nile virus, malaria, and so those are a really um, interesting and very distinct pathway of exit and portal of exit. So when we put together our portal of exit with our portal of entry, we start to understand where these chains of infection come from. And so there are a number of distinct routes by which infections are transmitted through a population. I'm sure many of these are common sense and approaches that you recognize, right? So, for example, direct contact through kissing or sex can transmit a number of infections: Epstein-Barr virus, gonorrhea, syphilis. Respiratory transmission. So again, when people are sick, we try to avoid hugging them or being in an elevator with them when they're coughing or sneezing. We ask people who are showing symptoms of the flu, or in this case COVID-19, to sort of self isolate for a period of time so that they're not coughing and sneezing and transmitting those infections to others. We can also have vertical transmissions. So this is mother to child. Typical vertical transmission associated infections are things like AIDS or syphilis. And then we can also have um, uh, direct transmission of pathogens through biological vectors. So things like mosquitoes or flies. So West Nile virus, Zika virus, and malaria are sort of classic examples of biological or what are called vector-borne diseases. Okay, we can also have indirect transmission of diseases. A common way in which diseases and infections are transmitted are on things like fomites. Fomites are going to be inanimate objects that transmit infection. I'm sure you can immediately think of a number of common fomites. So, for example, with the COVID-19, as we were preparing before spring break, I stopped handing out papers because those can be potential ways in which pathogens can move person to person. Other common fomites are things like door handles, silverware. A big one, a common one, is cell phones, right? So people always have their cell phone with them. A lot of people use their cell phone in the restroom. And so cell phones can really become inoculated and contaminated with a lot of different pathogens. And then, of course, using your cell phone. So if you're like me and still use your cell phone as a phone on occasion, you have it in very close contact to your ear, to your eye, and to your mouth. And so that's a very common way for infections to be transmitted. Infections can also be transmitted through food, water, or biological products. So typically when I teach this for the nursing course, we're going over epidemiology right at about Thanksgiving time. And so I highlight some of the issues surrounding Thanksgiving turkeys and why Thanksgiving is really, and the few days after Thanksgiving is a really big day for food poisoning within the United States. We can also have, again, aerosolized droplet nuclei, so things associated with tuberculosis or influenza. And we can also have aerosols from waste, such as feces and urine. And this is a common way in which the hospital-acquired infection C. difficile or Clostridioides difficile is spread from person to person in hospital environments. So again, the key points that I want you to recognize are that infections do have a characteristic mechanism of action, or a mechanism of infection. I also want to reiterate that infections can have more than one route of infection, and a classic example of this is Zika virus. So you may remember during the Olympics in Rio, there was a big concern over Zika virus because while people that were infected with Zika may have minor symptoms, Zika was associated with a high risk of a specific birth condition known as microcephaly. And so women who were pregnant or planning on becoming pregnant who were also infected with Zika virus were much more likely to give birth to children that had this microcephaly condition, which oftentimes is fatal. So Zika we understood to be a vector-borne disease, and it typically is a vector-borne disease. However, in the literature surrounding the time of and following the Olympics in Rio, there were a lot of reports in the scientific and medical literature of sexual transmission of Zika. So both in heterosexual transmission as well as homosexual transmission. And it really sort of identified this sexual transmission as a secondary way in which Zika could be spread person to person. So again, just to reiterate, while infections do have a characteristic mechanism of action, so for example, cholera or some other types of infections really follow sort of like a fecal-oral route, or Zika is predominantly a vector-borne disease. You can have other mechanisms of transmission, other chains of infection associated with the same disease. So then, a large part of our effort when we're talking about infectious diseases and how to protect people and communities focuses on how we break the chain of infection, right? So if we can prevent people from getting sick in the first place, it's far more efficient than trying to treat the infection after it has established itself. I'm sure you've been hearing a lot about hand washing. It's fairly prevalent in the news, right? So stores are sold out of soap. The good hand hygiene is the number one way to prevent the spread of infection, and you'll see a lot of people are using alcohol-based hand sanitizers, and in a pinch that's great, but really nothing beats soap and water. Nothing beats good old-fashioned soap and water for preventing the spread of infection. We also use barrier methods, so condoms are used quite frequently to prevent from sexually transmitted infections like human papillomavirus, syphilis, gonorrhea, and HIV and AIDS. We also want to keep our fomites clean, so keep your cell phones clean. Don't use your cell phone while you're in the bathroom. I know it's tempting if you're sitting there to check your email or whatever, but again, you definitely want to keep your fomites clean. You want to keep your cell phone clean. Folks who are immune compromised really should avoid using someone else's cell phone or someone else's silverware or drinking from a cup that somebody else drank from. And then, of course, if you are showing signs or symptoms of an infection, you should avoid contact with others. So if you've been contacted by a healthcare professional saying, hey, we think you've been exposed to COVID-19 in some fashion, you should self-isolate while you're monitoring your signs and symptoms. If you feel sick, you should avoid going out. And then, of course, with respect to COVID-19 in particular, many other countries have found social distancing to be really effective. So this has worked really well in some other countries to what's called flatten the curve, and we'll talk about that in a later video. But that's really what we're trying to do with canceling college classes, canceling sporting events. It seems to be working here. So we haven't had, we've now had cases of COVID-19 in the United States for several weeks, and we really haven't had a serious. We've had a few isolated serious outbreaks in places like New Rochelle, but nationwide we seem to be sort of slowly burning through the COVID-19 outbreak, as opposed to having a whole bunch of people getting sick and going to the hospital within a few week period.